Sometimes what seems to be inattention or bad behavior is truly just a vision issue. If you don't know me, I'm Dr. Rupa Wong. I'm a board-certified pediatric ophthalmologist, been taking care of kids for 18 years, and I have 3 kids of my own. They are 1 tween and 2 teens, and this is a space where I live. I take care of kids in my community. I take care of friends of my children, and I do think it offers a little bit more of an up-close and personal look at these kids and what's going on because I know them. You know, I live in Hawaii. Our community is small. I know these kids outside of my office. I see them at the beach. I see them, at the shopping malls. I see them on hikes. So I know how they're interacting with their daily environment. And I know that there's more often to how these vision diagnoses affect kids that sometimes teachers and other people may miss. So first, let's start with some of the common classroom red flags, which might be a vision disorder in disguise. Skipping lines when reading aloud, losing their place when reading, copying words or numbers incorrectly. That can be very challenging for some kids with vision issues. That can also be a sign of a working memory issue. So there's so much overlap with a lot of processing issues and vision. Sometimes it's very difficult to tease it apart. But we do want to make sure that these are not just ascribed to bad behavior or poor focus if there's truly underlying eye pathology there, avoiding books or reading, or if the placement in the classroom seems to affect their focus in the class. Kids with astigmatism may need to sit at a certain spot because maybe one eye has more astigmatism than the other. They don't need to be sitting. It's worse when they're sitting on the right side versus the left side. Kids that are nearsighted need to be up in the front of the class. Kids with strabismus may need to sit up in the front of the class. These are all things that might be a red flag. Avoiding books or worksheets, rushing to turn in the homework just because if they have a vision problem, it's just so difficult to maintain straight eyes. It's so difficult for them to see. Maybe if it's blurry and they need glasses, they just want to get it done as quickly as possible. They may also complain a lot of headaches or eye fatigue or just feel pressure, however they actually do describe that. But these are all signs that there might actually be something vision going on. Tilting their head, either tilting this way or this way, which we call a head tilt, or we call this a face tilt, a face turn. Turning their face these ways could indicate a misalignment of their eyes or astigmatism. And the reason for that is there's 6 eye muscles that move the eye around, 2 that move it horizontal, 2 that move it vertical, and 2 that twist the eye. But each muscle actually has 3 different actions. So when you are in different positions, whether tilting or face tilting, that's activating certain eye muscles. So if your child has some misalignment of the eyes that's giving them double vision, and most kids are not going to tell you, oh, I've got double vision. They just know it doesn't feel right and it hurts somewhat to look at things or it just makes them feel funny. They are naturally going to adopt a head posture to avoid that. And what they do when they are activating the other muscles, it makes the double vision less. So that's something to watch out for. Does your child always watch TV like this? Do they always seem to watch like this? That doesn't mean you need to correct them, but it's a sign that you need to bring them in to see us so we can figure out what's going on. Because likely I'm going to tell you, let them do whatever head posture they need to keep seeing single and to see well. That is very important. But again, it could just be a guide that there's something going on. Now, why do these vision issues then get misdiagnosed as ADHD or behavioral problems? Well, teachers got a lot on their plates. Oftentimes they are taking care of classrooms of 25 to 30 kids. They are not trained to be pediatric ophthalmologists. I am not trained to be an educator. I cannot do anything that a teacher does. So they're going to miss some subtle clues. So I do not fault the teacher who thought that my child had a behavioral focusing problem because I didn't do my part in communicating that he actually had an eye issue. These subtle signs, the eye is not wandering out all the time. It's very easy to miss. So the teachers might not be aware of these different ways that some of these vision things can present. And if you've had a school vision screen or even a screen at your pediatrician, they may miss this. Again, your pediatrician is checking vision, one eye than the other, and having them read an eye chart or doing, sometimes these photo screeners are a little bit better than reading an eye chart. But if they're doing just an eye chart, they're not checking the alignment of the eye. They could be missing intermittent misalignments that could be affecting the way that your child interacts with the classroom and even with other students and with their homework and the reading material. I mean, everything. So don't just think because they had a good screen at the pediatrician, everything checked out normal, or a nurse checked their vision, that it can't be a vision issue. That's not necessarily the case. And then I think the biggest reason is something that I touched upon earlier. There's so much overlap with vision issues and neurodivergence. There's a lot of overlap with ADHD and vision issues. And then dyslexia in itself can present like it's a vision problem when it's not. There's difficulty with reading fluency. You get the letter reversal. So a lot of parents might think it's vision when it seems to be dyslexia. And a lot of processing problems. The way that the brain interprets the visual system can also be at play. So there's so much overlap between these two worlds. It can be difficult to discern, but we need to make sure that it's not a vision diagnosis before anything else. So what are the specific vision conditions that can mimic a learning disability? First, convergence insufficiency. Convergence insufficiency is when your eyes converge when you look at things up close. So try to look at something up close or ask your friend to do it. You'll notice their eyes cross in. A lot of people have difficulty with that mechanism of convergence. Because of that, that's also linked with your ability to focus up close. So if your eyes can't converge, if they can't cross in, then it's more challenging for you to read things up close. And then kids are going to avoid those things. Their eyes might even wander when they're looking up close. So really simple exercise that I give parents is a pencil push-up, where I tell them to take a pencil. Kids should be able to get all the way to their nose, like a little push-up, and then out again, keeping that pencil single. It's a very easy thing to do. And again, it can mimic a learning disability because kids are going to avoid reading. They're going to rush through tasks to avoid feeling like their eyes are wandering out constantly. Accommodative insufficiency or accommodative dysfunction is something we see also in kids, usually around 7 to 9 years old, and then they outgrow it. So accommodation is your ability to focus up close. Most kids don't have any trouble reading things up close. They are not like us 45 plus year olds, 49, right? Soon. Or 50 soon. Oh my gosh. But when a kid has trouble with focusing up close, they're going to do the same thing. Usually we treat that with a pair of low power reading glasses, and they outgrow it within a year or two. Nothing to be concerned about, but again, something you want to address, because it's not that they can't read. It's not that they have dyslexia. It's that they have a difficulty with focusing up close. For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.